during the pregnancy. So during the pregnancy, some people, minimum percentage of the people will have insulin resistance in their body. So in such cases, the gestational diabetes occurs. This gestational diabetes is more risk for babies than the mother. So these are the 4 different types of diabetes what we are commonly having all over worldwide. And this shows some statistical report on the diabetes mellitus. And first one, it shows the adult diabetes in terms of millions, and different countries are given. Here we have taken common countries. And in India, according to 2019 data, India, we are having 75 million of people are affected by the diabetes mellitus. So it is a very, very common disease, and more all over world, the people are working how to overcome this diabetes mellitus disease. That is a very, very, since it is more common, and if it is not treated properly, the mortality rate will be increased. So that is why they are more working towards this diabetes, more concentrating on the diabetes. And if we take India, so India, here we are taking now battling diabetes in urban areas, we are having 11.2 percentage, and rural areas 5.2 percentage of the diabetes. Those people are struggling with the diabetes. And prevalence of the disease now presently 8.3 percentage in all over states, and 5.9 in the northeast. So in all other than northeast, we are having 8.3 percentage, and northeast states we are having 5.9. And pre-diabetes, it is diagnosed as 6 percentage, and Mizoram, it is a very, very lowest in the Mizoram, and highest in Tripura, that is 14.7 percentage. So these are the different data available on the, I have given only for example of data, statistical report, just to understand how effective this diabetes mellitus is. So why we are working on it, that is why I'm presenting this statistical report. A lot of reports are available on this diabetes mellitus. So presently we are having 69.2 million of Indian adult population has diabetes. So it is very, very alarming information that this much of people are affected by the diabetes. And 10.3 percentage of the India have pre-diabetes. So 10.3% pre-diabetes means only the diagnosed people. So without knowledge of pre-diabetes, more number of people are there. Okay. So when they are coming for diagnosis, it is observed that 10.3 percentage of the people are affected by the pre-diabetes. Okay. And 47.3 people, it is given that with diabetes are undiagnosed. So 47.3 people are with undiagnosed data. So it is very, very alarming information. So what are the complications of diabetes? So we are having this much of diabetes, and why we have to work in the diabetes? What are the complications we are having in the diabetes mellitus? So different multiple disorders happens because of this diabetes, that is the high blood glucose, that is hyperglycemia. And multiple disorders are of different types, macrovascular and microvascular type. And when we are having this multiple disorders, automatically we are having serial physical and mental disturbances we are having. So what are the different complications or we are having macrovascular and microvascular diseases are? So it affects all over our body, starting from brain to the foot we are having. So brain, we are having cerebrovascular disease, and heart, coronary artery disease, and extremities, that is peripheral vascular disease, ulceration, gangrene, amputation. So these are the external one. And eye, if we take eye retinopathy, that is very, very important, cataract and glaucoma, that is a microvascular type. And kidney, nephropathy. So nephrology is also affected, kidney is also affected because of the diabetes. And nerves, neuropathy. So neuropathy is also affected. So these are the different complications what we are having because of this macro diabetes mellitus. And so here we are going to see about different types of this complications, and what are the techniques available to diagnose, and what are the different works have done, and what are the different data sets available, how we can work on these different complications. So the common sites of disorders include cardiovascular system, nervous system, eyes, gastrointestinal system, genitourinary system, nasal and paranasal sinus region, hepatopancreatability system. These are the different systems in our body is affected by the diabetes mellitus. So here, what are the different imaging techniques are available? So here we are having invasive and non-invasive techniques are available for the diagnosis of the diabetes mellitus. And some imaging techniques are given here: radiography, ultrasonography with color Doppler study, echocardiography, computer tomography, magnet resonance imaging, and radionuclide scintigraphy, and PET also. And apart from that, we are having some special investigations also we are having. So these are some examples of imaging techniques available for diagnosis of diabetes mellitus for different parts of our body. Okay. And first, we are going to see about the coronary artery disease because of the diabetes mellitus. So what, because CAD, coronary artery disease, heart, is affected by the diabetes mellitus. And coronary artery disease is a major determinant of the long-term prognosis among patients with diabetes mellitus. So when people are having diabetes mellitus for a long years, automatically there will be a chance of getting the coronary artery disease. And when with the diabetes mellitus patients, the mortality rate is increased 2 to 4-fold compared to other normal persons. So for diabetes patients, we have to give more concentration when we are having the CAD. So this coronary artery disease is affected because of this infection. So there are the different variety of chances for getting these coronary artery diseases. That is infection, inflammation, hyperglycemia, insulin resistance, dyslipidemia, and thrombosis. So among all these cases, hyperglycemia is the very important one because the mortality rate provided by this hyperglycemia is more compared to other cases. So in order to diagnose this coronary artery disease, the main imaging technique what we are using is the computer tomography. And this diagnosis, diabetes is associated with the risk of coronary atherosclerosis, that is the building up of fats, cholesterol, and other substances in and on our artery walls. That is called as plaque. So in artery walls, we'll be having the formation of, that is deposition of fats and cholesterol. So that causes the CAD. And excess cardiovascular morbidity and mortality also occurs because of this plaque. And the mortality rate is increased to 2-fold risk for developing coronary artery diseases. And the what the imaging technique we are using is the computer tomography is the most promising imaging technique for the non-invasive evaluation of the coronary artery. It is a non-invasive technique. And recently, the CT technology available is with high resolution and temporal resolution, and having a fast coverage. Within a single breath, it can take the image of small and fast moving coronary arteries. That is very important. Within a single breath, we can take the image of this artery function. That is very important. Another technique, before going into the CT, the preliminary test we can follow is a cardiac stress testing. So cardiac stress testing is done by using the patients when they run on the platform used to measure this ECG. And here the diagram shows the procedure for CT imaging. All of you have aware of this one, how we are taking the CT imaging. So it is a non-invasive technique. And this diagram shows how this artery is affected by these deposits, that is the fats and cholesterol, and how the wall thickens and it blocks the artery and the blood flow. Okay, this diagram shows the CAD is the ischemic heart disease because it is a very dangerous. It is called as ischemic heart disease caused by the hardening or thickening of the walls of blood vessels that go to the heart. So blood vessels will be thickened because of the deposition of the fats and cholesterol. Sometimes when the amount of fats and cholesterol increases, it blocks the artery and the blood flow suddenly stops, that causes the heart attack. So this is the example. The diagram shows the importance of the coronary artery disease. And this is also the diagram, how the deposition, that is artery wall. In the artery wall, how the deposition is here, the artery wall is. So how the deposition is here, shown here. So the artery wall is blocked here. The artery wall is very, very small, and the plaque is built up inside the artery, and automatically it stops the flow of blood. So blood clot occurs and blocks the flow completely. So buildup of plaque ruptures and forms a blood clot or blocks flow completely. So blood flow completely stops. So automatically it moves towards the mortality. And so the preliminary test what we are following in the coronary artery disease is the stress testing. So it is a exercise stress test. It is designed to find out one or more coronary arteries feeding the heart contain fatty deposits that block a blood vessel of 70% or more. So it is only a preliminary test. So exercise test, and if we, from that we can find out whether the coronary arteries are feeding the blood to the heart properly. Otherwise, the fatty deposits are blocked is up to only 70% or more. So, but it is not enough to diagnose properly. So, additional testing is always required to confirm the test result. And for that, we are so when the stress testing is taken, the patient is allowed to walk on the treadmill, and ECG is taken, and by manually verifying this ECG, the physicians can give some idea, can come to some idea that whether it is proper or not. So that is the preliminary test. And stress testing doesn't accurately diagnose all cases of CAD. So the test is result is never by itself certain. So we have to go for the next level of the test. So this shows the computer tomography images, CT images during the functional stress testing. So this is a artery. So this diagram, this upper diagram here shows this block what we are having here. We are having the block here. So here we are having the block that can be found by using this CT. And this is also some other tomography images. Here we are having the thickened. This arrow shows this arrow shows that the artery is affected by this this part is affected by this plaque. So formation of fats and the cholesterol are there, so that blocks the artery walls and blocks the blood flow. So this is given right auricle and left ventricle, it is given that artery walls. And this is at computer tomography images. From the computer tomography imaging techniques, we can find out the level of artery diseases. We can find out. And so nowadays, the people are working with machine learning techniques. So the diagnosis of coronary artery diseases and cardiovascular disease, otherwise it is called as the cardiovascular diseases with the machine learning techniques. So a lot of people are working on that. So what are the data input features they are taking is ECG is a first input, and clinical data, test data they are taking, and that is demographics, the region where they are coming from, that is very, very important, and genomics data, that is the genomic data they are taking. So these are the input features, that is additional input features apart from the CT images. So CT images we are taking, and the CT cardiac images, with the cardiac images they are taking the additional input features. As a whole, they are combining all the features, and they are using some form of machine learning techniques. There are different machine learning techniques. So as a final, we'll see what are the different techniques available. So different machine learning techniques. So for machine learning techniques, we have to find out the features, and we have to select the best features. That is, feature selection is also very, very important. So come by giving all the input features, that is we are having input features data set is first formed, and from the input feature data set we have to select the features which gives the best diagnosis, that is the feature selection process will be there, and after that it is given to the machine learning algorithm, and in order to find out the diagnosis of the cardiac disease. So this is one type of method what we are following for diagnosis of cardiovascular diseases. And here we are having data set. We are having different data sets available. Okay. And these data sets are available from different countries. And this data set gives starting from 1948 to up to 2017, I have given. What are the different data sets available in different country, and what are the modalities the data sets are taken, and what is the size of the data set is also given. So based on the size we can use the data set either for deep learning or machine learning techniques. So starting from Framingham Heart Study, it is having greater than 5,000 images, started from 1948, and up to 2019 we are having cardiac acquisition for multistructure ultrasound generation in France, that is echo image, that is size is 500. So, and Hamburg City Health Study, MRI images greater than 45,000 images are there in 2016 they have given. So all are these are open source image, all are open source data sets. Everyone can use this one for our work. And this is the same one. What are the inputs we are having? Features. So we are talking about features, and in the features we are taking the cardiac image, the input image, and that image, from the image we can find out the conventional indices and the radiomics feature. So from the input image, what are the features we can take, and from the features we can find out whether the patient is diabetes or normal. So by using the machine learning or deep learning techniques. So what is this conventional imaging indices? So first one is the conventional. From the raw image, we are taking the conventional image indices and the radiomics features. So what is this conventional imaging indices, or the ventricular volume? Okay, that is from the image we can take the ventricular volume. So in the heart we are having the ventricular. So in the ventricular volume during the diastole and systole condition, during these conditions, ventricular volume size is measured, and ventricular ejection fractions are measured, and endocardial epicardial boundaries, that is the segmentation using the segmentation technique, we can find out the endocardial epicardial boundaries techniques. These are the features we can take it from the images, cardiac images. And from the same images, we can find out the radiomics features. So radiomics features are nothing but the digital images into a mineable data. That the image is converted to a data. So what are the data we can have is, from the image, we can take shape features. So shape features are nothing but the volume, surface area, sphericity, axis, diameter, surface to volume ratio, flatness. So these are the features can be taken from the shape. Okay. And intensity of the image, from the intensity of the object or that part, the artery or whatever we are concentrating, region of interest. So this intensity, we can take the statistical data. The statistical data are mean intensity, range, skewness, and entropy we can take. And the next one is the texture. Okay, based upon the texture, so we can take the GLCM check texture, so that gives to the contrast and the correlation. And next one is the GLSJSZM. So it is a number of connected vowels, that is connected pixels are there with the same intensity levels. So gray level values or non-uniformity zone entropy features are we can take. Okay, so it is a zone based, and first one is the common. Okay, GLCM is the common gray level co-occurrence matrix, that is for a whole image, and it is a next one is the zone based, and next one is the GLR-LM is again is a that is a gray level co-occurrence features, but it is based upon the run entropy and long run emphasis and short run emphasis process. So it is a higher order, that is GLCM is the second order. When we go for GLS is a term, and GLS JLR LM. It is a higher order features. And next one is the texture NGTDM, and it quantifies the difference between the gray value and average gray value of its neighbors within a predefined distance. So this feature is also very higher order feature, and it is used to calculate the strength and busyness. And the next one is the texture GLDM. It quantifies the gray level dependencies in the ROI. Okay. So we can find out the non-uniformity, dependence entropy, and dependence variance from this texture GLDM. And next one is the fractal dimensions. It determines the ratio of change in the detail to the change in the scale. So these are the some of the radiomics features that can be calculated from the cardiac images. So the cardiac images. So these features we can also use in our work. So using this type of features and methods, we can diagnose the cardiovascular diseases or coronary artery diseases. And recently, that is Aliza Dashani et al. Have worked on this CAD using the machine learning and deep learning techniques. And what they given is they have given a benchmark data. Okay, so far I have showed here. This slide shows the different data sets available in different countries, but no benchmark data is so far available. Recently, this Alisa Deshani has given a benchmark data comprising of all the data sets available. Okay, so they have developed a www.kdata, that is the coronary artery dataset.com. So you can note it down. This is a coronary artery dataset.com. So whereas all the data sets are available for a coronary artery disease, so it is a publicly available. Okay, you can all we can work on that. So it is a benchmark data. They were provided a benchmark data. It is only given in July to 2020 only. It is opened, and the advantages of this is by using this benchmark data, we can so because for all other abnormalities, for all other imaging techniques, some benchmark data are available, whereas this coronary artery diseases, so far no benchmark data is available. So now only we have this benchmark data. So by using this, we can work on machine learning and deep learning methods, because for deep learning methods we need a large data set. Otherwise, the outcome will not be effective. So we need only large data sets. So integration of different data sets are possible since we are having this type of data set now. So so because of this, early detection is possible in the coronary artery diagnosis, and decrease of mortality rate will be achieved. And in this machine learning and data mining technique provides the priori probability of diseases, and use this probability to selectively target patients for angiography. So after diagnosis, only the patients affected most will be can undergo this angiography. These are some advantages of this machine learning data mining techniques. And this machine learning data mining techniques can extract hidden patterns in the collected data. This is very important, whereas in the manual process, it is not at all possible. So hidden data from the images is possible by using this machine learning data mining techniques. So this benchmark data is available in the www.cadataset.com. So this is the view of this CAD dataset, and we can. So all of you can go into this CAD dataset and make use of this CAD dataset. And the next complication what we are having is the nephrology because of the diabetes mellitus. So diabetes and nephrology, here we are going to see. And again, the normal kidney is given in the first one, and abnormal is given in the second one. So in the normal kidney is, so we are having different parts where that is podocyte and foot processes and mesangial capillary loop and mesangial matrix, glomerular basement membrane, and corneal cell, we are having different one. So all these are, if we see the difference between these two, we can easily identify what is the normal and abnormal changes. So diabetic kidney disease induces structural changes in the kidney. So normally there automatically there will be structural changes, including thickening of the glomerular basement membrane. So glomerular membrane becomes thickened, whereas here it is like this. So here it is thickened, the membrane become thickened. And fusion of food processes. Food processes are combined together. So here we are having the separate food process. So whereas here we cannot identify the food process, all these are combined as a single element. And loss of podocytes, there is no podocytes. So podocytes here present, and here the absence of podocytes, and with the denuding of glomerular basement membrane and mesangial matrix expansion. So the mesangial matrix is expand here. So the size is increased, whereas the size is decreased. That is compared to that, the size of the mesangial matrix is more. So these are the structural changes occurs because of this diabetes in the kidney. So this for kidney, we are using the microscopic image, electron microscopic image in order to diagnose the kidney abnormalities. So electron microscopic images of structural changes in diabetic kidney diseases. The structural changes in diabetic glomerulopathy found by with electron microscopy. So here we are having three different regions are given here, A, B, and C. And A indicates a marked expansion of mesangium, and B indicates the capillary basement. So this is the thickening of the capillary, that's a glomerular basement. And C indicates the segmental, that is the segmental effacement of visceral epithelial food process. So this is food process are combined together. So this is this three different regions are given, whereas in this normal glomerulus it is different. So this can be found out by using the electron microscopic images. So if you want to work on this kidney means nephrology, we can use this type of electron microscopic images. This is again electron microscopic image, the same kidney nephrology, diabetes kidney, different abnormalities here we are having. And here again, same this microscopic image, and different abnormalities are shown. That is A denotes the normal, A denotes the normal, B is the thickened tubular basement membranes, B is the thickened membrane, and C is the arteriole with an intimate accumulation of hyaline material with significant luminal compromise. And next one, fourth one, D is the renal tubules in advanced diabetic kidney disease. So it is a renal part. It is advanced kidney disease, diabetic kidney disease. So from this electron microscopic image, we can find out the that is affected part of the kidney. And apart from that, we can use the isotopes. So isotopes, immuno microscopic images, that is the using the isotopes, that particular when the we are given with body is given with some form of isotopes, and because of these isotopes, the particular area of the kidney part will be given clearly. So that diagram, that image is given here, that is a mesangial, capillary, granular, and both combined together it is given here. And these are using the isotopes. Okay, that is a immunohistological evaluation of glomeruli. So immunohistological images. So using the isotopes. So these are the different images available for the diabetic nephrology. And what are the different work is going on recently in the diabetic nephrology is using the deep learning technique. So here we are taking the immunohistological images. So different images are taken by using the different isotopes. Here it is we are using, and different forms of the images are taken. All the images are given to the convolutional neural network, and from that the output is taken for the diagnosis. And recently, if we compare this physician and deep learning outcomes, So the same data, when it is given to the physician, doctors, whereas in the case of AA, that is artificial neural network, um, with a ratio of, they have given the accuracy ratio of 83 point, the same data is given to physicians as well as the neural network, that is the AA, that is deep learning networks, and whereas the accuracy is provided by the not convolutional neural network is 83.28 plus or minus 11.64 percentage, and precision ratio is 80.56 plus or minus 21.83, and recall ratio is 79.87 plus or minus 15.65 percentage. Okay, and on the other hand, the diagnosis is done by the nephrologist, and they have given the correct, that is accuracy is only 67.5 plus or minus 6.12, and precision rate is 62.62 plus or minus 3.85, and recall rate is 67.26 plus or minus 9.96. So these are the differences what we are getting. So what we can conclude is surely the deep learning techniques will aid the nephrologist or physician in helping the diagnosis of any diseases. So because a lot number of features can be taken by the deep learning techniques, that features gives a more accurate result compared to the normal test results. That is why the artificial intelligence could diagnose the diabetic neuropathy in a superior way to compare to the nephrologist. And in the case of nephropathy, diabetic nephropathy, what are the data we are using? Normally, this data set is available, and totally we are here 64,000, nearly 64,000 diabetes diabetes patients of 64,000. The data sets are taken, and the data sets are the features what we are using in the from the data sets are structured data. That is, structured data are lab test, medication, anamnesis, etc., and text data, diagnosis, treatment records. So based upon the images data we can take, and longitudinal data, that is a laboratory test we can. So all these data are considered to be features, and by this using these features, we are going for time series data pattern, not a particular time we are measuring. For a particular period of time, we are measuring this. What are the changes in the data sets available? That is the features available. So based on that, we are predicting the diagnosis, predicting the abnormality condition, whether they are more affected or less affected. So it is a 6-month duration. What we are taking is 6-month duration for diabetic kidney disease aggravation period. So it is a time series data. We are taking the time series data. So these are the different features what we are using for the diabetic nephropathy. So laboratory test, and the laboratory test we are taking normally. If we take the urine or whatever it is blood, we can take albumin, ALT, amylase. These are the parameters we can take. And from these parameters, we can calculate this statistical data in the right hand side, what is given. And from urine, albuminuria, protein, and standard deviation for monthly mean data. So it is a periodic data. So for a period of 6 months, we are taking time series data we are using. In statistical, we are having a different types of analysis. So here we are using time series data analysis for our diagnosis period. So this method is used for the diabetic nephropathy diagnosis. So the third one is the eye, that is diabetic retinopathy. So in diabetic retinopathy, so normally more people are working on this diabetic retinopathy, and normal retina and diabetic retina is given here. And diabetic retinopathy diagnosis can be done by using the fundus images. So this is the fundus image what we are having. So here we see between the difference between the normal and abnormal diabetic fundus image. So where the blood vessels, that is are very thickened here, and here we are having dots also like this. Blood dots are, tiny dots are available here. Also we are having the dots are available. So this is because of the diabetes. So here we can see different parts. So this is a normal retina here, macula and retinal blood vessels and optic curve. So these are all normal. When diabetic retinopathy, so these white spots are available. These white spots are called as the cotton wool part, and the capillaries are that is exudates are nothing but liquid like that is lipids that is called that coming from the eye. So that is exudates that is called and micronuciums that is called as the hemorrhage what we are having, and neovascularization is also there. So these are the abnormalities in the diabetic patients. So diabetic retinopathy, it is a diabetic eye, and what it causes is progressive loss to the retina. So when we are having the diabetes and retinopathy, it causes the progressive loss to the retina, and it is mainly because the capillaries of the retina are damaged. So, but a diabetic retinopathy is mostly unpredictable at early stage. Only advanced stage we are finding this a diabetic retinopathy. And here the diabetic patients suffer from loss of vision due to leakage of lipid that is called as the exudates, blood vessel burst. Sometimes the blood vessel that is the pressure is more in the blood vessel, so it is burst, and there is a and it become thin also. The blood vessel become thin, wall become thin, and so the blood vessel bursts occurs, and sometimes the blocks the blood supply to the retina. So these are the causes of the diabetic retinopathy. And diabetic retinopathy includes the micronucium, so tiny dot of the blood, hemorrhage, and exudates. So these are the main cause of the retinopathy. That is the visible parts available in the diabetic fundus images. And here the causes occurrence of most 95% blindness. Okay, so it is very tedious. That is most affected disease, diabetic retinopathy to our eye. So here, so automatic analysis of diabetic retinopathy helps in preventing vision loss. So in order to prevent the vision loss, diabetic retinopathy will be diagnosed at an early stage. And here automatic detection of hemorrhage using colorful fundus images. Normally how we are finding this automatic analysis is using the machine learning. For example, supervised learning techniques are used to classify the data, hemorrhage data and without hemorrhage. So the normal common classifier what we are using is the SUM classifier, and we can go for other classifiers also. Nowadays we are having different types of classifiers with different machine learning techniques, boosting algorithm, bagging algorithms. Yeah, lot of types are available, and we can use a efficient classifier for our diagnosis. And and in order for diagnosis we need a features, and we are using the statistical features. These statistical features are standard deviation, energy, entropy, and contrast of an image. And it is used for the classification of approach, and sometimes segmentation approaches are also used by using the machine learning techniques. So after feature detection, we have to use the morphological operations to detect the blood vessels and hemorrhage detection using the segmentation technique. And in order to get the maximum accuracy, we can go for optimization technique like goal form goal wolf optimization techniques are there recently we are using. So that optimization techniques may be used in order to improve the accuracy and sensitivity of this performance. So normally this is the process what we are following in the diabetic retinopathy. We are taking the fundus images, and this fundus image is color image. It can be converted to a intensity image, and we can apply filter in order to remove this eye band intensity value, and we can go for any enhancement technique, and we can find out the region of interest, and we can main aim is to find out the neurosims and that is blood vessels. So we can find out this by using any one of the segmentation techniques. So this is the normal process what we are following in this diabetic retinopathy. And what are the different data sets available for the diabetic retinopathy? We are having a large number of data sets are available. So these are the data sets given. You can use you can use make use of these data sets if you are working on that. So it is a publicly available data sets. So starting from direct DB1 to Kaggle, EAPTA, DDR, Drive, HRF, each data set consists of a large number of normal and abnormal images, and we can use make use of this images data set for our work. And Again, diabetic retinopathy is always a diagnosis of diabetic retinopathy is all deep learning is used in the diagnosis, and in the deep learning is most widely used. What are the neural network techniques? What we are using is the Boltzmann machines, convolutional neural network, autoencoder, and sparse encoding. The performance of these methods increases when the number of training data increases due to the increase in the learned features, unlike machine learning methods. So also DL methods did not require handcrafted feature extraction, because if you go for a deep learning methods, only we have to give the data set, automatically the feature extraction happens and the diagnosis will be obtained. So these are the different networks available in the diagnosis of the diabetic retinopathy. And next one is the cerebrovascular disease. And this cerebrovascular disease refers to a group of conditions or disorders that affect the blood vessels and blood supply to the brain. So it is for this we are using the MRI, magnetic resonance imaging. So yes, it is related to brain, and here the brain nerves will be damaged because of this diabetes, that is called as the cerebrovascular disease. And here the blockage, malfunction, and hemorrhage prevents the brain cells from getting enough oxygen, and so the brain damage can result. So the diabetic cardiovascular cerebrovascular diseases are defined as because of the sugar, fat, and series of nutrient substance metabolic disorders. And normally the patients with the diabetes of 20% to 40% of type 2 diabetes are suffering from this cerebrovascular disease. So in the cerebrovascular disease, two main conditions are we are analyzing, that is the ischemic stroke and hemorrhage stroke. So two main conditions. What is the ischemic stroke? It is a blockage of an artery. Okay, it is a blockage of an artery. So automatically blood supply stops and oxygen entering into the brain will be stopped. That is the ischemic. So because of this stop of oxygen to this brain, stroke occurs. Brain stroke occurs. And the next one is the hemorrhage stroke. Is blood when an artery becomes bleeding into the brain. So when we are having a blood vessel and when the blood vessel is break, so break occurs, that is a break, and so bleeding occurs from the blood vessel and the blood enters into the brain region. So in the when the region affected by the blood, that region is not functioning, so automatically damage occurs that causes the hemorrhage stroke. So these are the two main causes of the cerebrovascular diseases because of the diabetes mellitus. And in diabetes, in cerebrovascular disease also, we are having different works based upon the machine learning approach. And here I have given the different works what have been done in this stroke and diabetes with the machine learning techniques, and how much accuracies are obtained. Starting from Asadi et al. Using the artificial neural network, and obtained 70% of the 70% of the accuracy, up to this Scalzo et al. Nonlinear regression model, prediction of HQ greater than 85% accuracy is obtained. So these are the different works were done in the stroke and diabetes with mellitus. And what are the different networks we have used is different algorithms used is convolutional neural network, geodesic active contour, hemorrhage transformation, middle cerebral artery, modified ranking scale, rainforest or algorithm, and symptomatic infractional hemorrhage, spectral regression, and kernel discriminant analysis. These are the different algorithms used to diagnose the stroke, ischemic and hemorrhage stroke in the cerebrovascular diseases. And what are the main limitations in the case of diagnosis of cerebrovascular diseases is again sample size. What we are using, the data set should be of tremendous magnitude, but data set of this size is not available for this acute ischemic stroke. Okay, for AAS, the sample data sets are not available with a tremendous magnitude, because when we go for deep learning, the sample size should be very large. And another limitation what we are having is the need for labeling region of interest. What region we are going to find out? That is, labeled image is very, very important for this deep learning technique. So labeled image is not available in the case of ischemic stroke. So these are the limitations what we are having in this diagnosis of the cerebrovascular disease. And the next one is the diabetic neuropathy. So diabetic neuropathy is a nerve damage, okay, because of the diabetes, and the blood sugar, high blood sugar always affects the nerves throughout your body. So diabetic neuropathy damages nerves in our legs and feet. And so normally this is a common cause for all the patients when they are having the diabetes. So the symptoms are pain and numbness. So normally all diabetic patients will be having the numbness in legs and feet, and with the digestive system, urinary tract, blood vessels and heart. And some people will have mild symptoms and some people will have the effective symptoms. And 50% of the people are affected by the diabetic neuropathy. That is a very, very common cause of this diabetic neuropathy. And we are having different types of neuropathy: peripheral neuropathy, autonomic neuropathy, and proximal neuropathy. So peripheral neuropathy causes the numbness, burning sensation, sharp pains, serious foot problems such as ulcers, infections, and bone joint pain. And autonomic neuropathy causes the hypoglycemia awareness, bowel problems, vomiting, loss of appetite, high adjust from light to dark, decreased sexual response. And proximal neuropathy, severe pain in hip and thigh or buttock, eventual weak and shrinkage thigh muscles, difficulty rising from a sitting position, several stomach pain, severe stomach pain. So these are the neuropathy problem what we are having. The final one, the neuropathy problem, is mononeuropathy, and this is a focal neuropathy. It is because of the eyes. So it affects the eye, difficulty focusing or double vision, aching behind one eye, paralysis on one side of your face because it occurs in face, numbness or tingling in your hand or fingers, weakness in our hand that may cause to drop things. So these are the different types of neuropathy effects what we are having in the diabetes. So this is a diabetic neuropathy. So because of this diabetic neuropathy, we are having different effects. So one such method used to find out this nerve problem what we are having is pedobarogram. Okay, it is a very, very important technique, pedobarogram. And this pedobarography is a new diagnostic tool, enables measuring the pressure between the foot and the floor during dynamic loading. Dynamic analysis of foot shows advantage over static analysis due to its capabilities for detecting high load points in certain disease and in certain phases of the walking. Pedobarography as a new method in the context of rehabilitation include wide range of clinical entities. So pedobarogram is nothing but the pressure measurement. When the patients walk on a pressure mat, the mat consisting of sensors that measures the pressure at different points of the foot, and from that pressure values, diagnosis can be done. That is called as the pedobarography. And it can be pedobarography can be analyzed with the static and dynamic loading. So normally dynamic loading is done, and pedobarography is foot pressure assessment between the plantar surface of the foot and the supporting surface typically using the electronic sensors we are using. So in diabetic hospitals, normally they will be having this pedobarograph measurement. They'll be having the sensors, that is the bed, and using that bed, the pedobarogram is measured for each patient. And from the pedobarogram, the physicians are analyzing the effect of the neuropathy in the for the patients. So individuals with both type 1 and type 2 diabetes are at risk of developing diabetic peripheral neuropathy, which predisposes them to the development of plantar foot ulcers. When automatically the neuropathy problem increases, that causes the foot ulcers. So sometimes the foot ulcers causes the removal of amputation. So amputation, it leads to the amputation. So it is a very, very severe problem. And to investigate the outcomes of a biochemical features in individuals with diabetes related foot complications termed the high risk foot. And normally the diabetes includes monitoring patients for high risk of ulceration, determining pressure offloading capacities, and investigating the mechanical factors responsible for foot ulceration and ulcer healing. So these are the advantages of using this pedobarogram. Why we are going for the pedobarogram. So this diagram shows the stages of foot ulcer. So first one is the mild one, and medium. Second two is the medium, and the last one is the very severe one. So normally then when the foot ulcer is like this, automatically several complications occurs. The diabetes patients cannot walk properly. So this is a very severe problem. So early detection again by using this pedobarogram, the neuropathy effect can be if early detected, then it can be cured somewhat. So this is the arrangement for the pedobarogram and what type of pressure fields we are getting from this pedobarogram. So this is the pressure sensor. This is the mat what we are having. In the mat we are having, this consists of a lot of pressure sensors. So it is a matrix type. Okay, M by N size of the sensors are arranged depending upon the size of the elements, and each element, that is a pressure sensor, gives the output of depending upon the loading what we are applying. So the loading applied, so the load what we are given, what is given to the pressure sensor or is depending upon the neuropathy effect. So if it is normal patient, there will be some value of pressure. For abnormal cases, the loading effect will be different. So automatically the pressure variations will be there. So by using that pressure variations, the physicians will conclude that how much abnormality will be there. So these are the diagram shows the how the pressure fields are developed become from the pedobarogram. So this for identification of foot pathologies, we are taking the plantar pressure from different parts. So here we know that when we place our foot in any path, the pressure will be maximum in this area, red. So in this area where it is red, where maximum pressure will be given. In all other areas, the pressure will be minimum. So in this path, automatically by using this pressure field analysis. So for diabetic patients, when the pressure is given more in a single area, there will be formation of foot ulcer. So we have to change the pressure area by properly designing the foot, that is chapels for diabetic patients. So automatically the pressure points will be varied accordingly so that the foot ulcer can be minimized. So these are the different methods by which we can find out the foot pathologies based on the plantar pressure asymmetry. So here first stage we have taken different analysis, different foot pressure points and how it is analyzed. Okay, how it is analyzed, how it is taken and different points, what are the pressure values we are taking. Everything it is given here. And based on this, we can analyze whether the patient is normal or abnormal. If it is abnormal, how much abnormality is there? That is very much important. And depending upon the abnormality, we can find out that the physician will suggest the solution for this abnormality. So normally, so now recent days, this pedobarogram not only used to find out the foot ulcer, it also used to find out the deformation. So depending upon the walking style, there will be deformation in the foot will be happening. Not only the diabetic patients, normal patients, normal cases also, depending upon the walking style, the deformation of foot happens, and because of the deformation, there will be the so there will be developing of pain in the foot and leg will be there. So in order to overcome that, we are taking the foot deformations, different walking styles. We are taking the pedobarograph, and based upon the analysis, the deformations are analyzed and by using the deep learning and machine learning techniques, the accuracy of deformations are measured, and based upon that outcome, we can suggest the design of the insole for this insole of the chapel for the particular patients. So the nowadays this research is also happening. And what are the different algorithms we are using is fine-tuned visual geometry group, that is VGG16. It is a completely different algorithm, and k-nearest models and stacking ensemble model. Recently, this type of algorithms are used, and we can increase the cross-validation, number of fold cross-validation depending upon our accuracy and robustness. And these are the types of deformations what we are taking. So not concave type, normal and flat we are taking, and how much, what are the areas we are concentrating in order to find out the pressure points. And we are taking the heterogeneous pressure data. So not only the maximum pressure we are taking the minimum pressure area also we are concentrating. So based upon that, we are calculating the outcome and deformations. So these are the method by which we are calculating the performance of deformation by using from the input data. So here we have used this combining both the image processing as well as the machine learning as well as the deep learning techniques are used here. Both are combined together in order to get the effective outcome. So apart from that, images and like that, normally the diabetes can be find by using this normal biomarkers, body biomarkers. So that is laboratory biomarkers. So that biomarkers are given by using the data set, that is PIMA Indian data set. It is commonly available data set. Lot of people are working on this PIMA Indian data set. Here nearly 736 data sets are available with the features of insulin level, glucose, blood pressure, BMI, that is body mass index, age, diabetes pedigree, pregnancy, skin thickness, and outcome. So these are the different biomarkers are used in order to diagnose the diabetes mellitus stages. And we can go for the early detection, and by using these features we can go for either deep learning techniques or different machine learning techniques for the diagnosis. Apart from that, we can go for the our own data sets also by getting it from the hospitals, known hospitals. We can combine this already that is a benchmark data set. This PIMA Indian data set is a benchmark data set available for the diabetes mellitus. So apart from that, we can use our own data set, and based on combining these two data sets, we can combine how these outcomes are there for our algorithms. We can work on that so that it will be very helpful. So normally when we go for the diagnosis of any disease, so what is our objective is to get a data set. Okay, for any diagnosis of any abnormalities, the main aim is to get a data set or images. Data set may be of images or numerical data, whatever may be, we can get the data set. And if we work on the image processing, we need images. And if we go for machine learning or deep learning, images as well as text data is okay. But if we go for deep learning, we need a large data set is available. Large data set we need. And if we go for feature extraction is not needed in the case of deep learning. And if we go for machine learning, we need a feature extraction. Once the feature extraction is done, we have to go for the feature selection. So normally we are using machine learning techniques. We are using the correlation method, that is the heat map is generated by using different features. Based upon the heat map generated, we can select the features, and we can use that selected features in the case of the machine learning models as classifiers. So normally we are using SVM, random forest, boosting algorithms, different boosting and bagging algorithms are used. Ensemble methods are also used nowadays. So a lot of ensemble methods are used. Voting ensemble is also used here. And if we go for deep learning methods, again, we can select the CCN and deep learning with different models. We can select different networks are available. For our application, we can choose our best model and we can analyze the output. And the outcomes what we are measuring is normally we are measuring the accuracy, specificity, sensitivity, and area under the curve, region of curve convergence for classification and prediction. So these values are calculated by taking the true positive, false positive, true negative, and false negative values. So this is the common approach what we are following in all the diagnosis of the diseases. So only thing we need is a data set and a vast literature survey is needed so that we work on that particular area and we can do our research. So with this, I conclude my presentation and hope this presentation will be helpful to you. Thank you. And if you want to discuss anything, we can have a discussion now.
Thank you, ma'am.
Thank you.
Any queries, dear participants? If you have any queries, you can ask freely. Or your questions may be shared or posted in the chat box.
I think this presentation must be useful for you. I think hope this is very much useful. Can I get any feedback? Shall I get any feedback from the participants?
Okay, ma'am.
Okay, thank you, ma'am. Thank you.
Thank you, ma'am. Thank you, ma'am.
Priyanka, ma'am? Yes, ma'am.
Okay, so carry on,
ma'am. It's my privilege to propose a vote of thanks on this seminar. On behalf of the Department of Biomedical Engineering, PSNA College of Engineering and Technology, I would like to thank our today's guest speaker, Dr. C. Karthikeyani, Professor in the Department of ECE, Excel Engineering College, Namakkal, who delivered the innovative idea on this topic, medical imaging techniques for diagnosis of diabetes mellitus abnormalities. I hope the participants who are involved in the research work, definitely they get some idea to carry out their future work in this field. Thank you. Thank you very much for sharing your valuable information with us. Thank you, madam.
Ma'am, excuse me, ma'am. There is a question in chat box. Dr. John is raising. Is there any difference between the left and right leg pressure for a normal person? Also, there will be a structure of the foot varies. Then how can we see the threshold value of the foot pressure?
Okay. So normally the pressure value is not uniform between across the legs. So depending upon the standing position and walking style, the pressure will be varied. Actually, my patent is one of my patent is based upon this pedobarography. So that is why very much I am interested in that. So we measured the pressure. So normally we are measuring the pressure in standing position. In standing position, when the people is standing on this pedobarogram, they are placing the legs properly. So the doctor will advise that properly place the legs in the mat. So normally what happens, it may vary between the pressure may vary between the right leg and left leg. So we are not going for any common threshold value in any way, depending upon the area. So normally if we take an image processing itself, if we take a global threshold is not at all advisable. If we go for a region-wise threshold, it is very much useful in order to analyze the abnormality. So in this case also, since the pressure is not equal for even for a normal person, common threshold cannot be useful. Okay, so that is why we are taking the pressure values in area wise. So I have shown the diagram in each leg. We are taking these pressure points area wise, and we can fix the threshold for the analysis. I think my answer satisfied you, Mr. Dr. John. Dr. John.
Yes, ma'am. I think so.
I think he is not there.
Yes, ma'am. Okay, ma'am. Thank you
Okay.
very much. Thank you very much, ma'am.
Thank you.
Thank you, ma'am. Dear participants, next session will be started at 11:30.
Sudha? Hello? Sudha?
Sir, am I audible, sir?
Yes, ma'am, you are audible.
Yes, sir. Yes, sir. Thank you. Good morning, all. I would like to introduce the session of speaker of this session, Mr. Jijasu, works as a senior application engineer at Integrated Microsystem, Gurgaon. He has been working on several EDA, CAD tools, computational modeling, and simulation tools from the past 6 years, and has gained expertise simpleware software from Synapsys. He looks over the technical support for this software and closely works with simpleware customers to help them with their designing and modeling needs. Another part of his work is to provide training to existing customers and demonstrations to various institutes and faculties who are working in the field of medical image processing, patient-specific implants design, surgical planning, 3D printing, and in materials modeling, manufacturing, and simulation. So I would like to introduce one more speaker of this session. Mr. Pradeep works as an application engineer at Integrated Microsystem, Gurgaon. He has been working on several medical image processing softwares, FE, CFD, and CAD tools, material modeling and simulation tools from the past 3 years, and has gained expertise in simpleware software from Synapsys. So he looks over the technical support for this software and closely works with simpleware customers to help them with their designing and modeling needs. And another part of his job is to provide demonstrations to various institutes and faculties who are working in the field of medical image processing, patient-specific implant designs, surgical planning, 3D printing, and in material modeling and manufacturing simulation. With this small intro, I would like to call upon Jijasu and Pradeep sir to present their presentation. Thank you, sir. Welcome.
Thank you very much, ma'am. I am Jigyasu. As you are now informed that I'm working as an application engineer at Integrated Microsystem. So Integrated Microsystem is the representative for Synopsys Simpleware software in India. And we'll look over the sales and support of this software in our region. So today we will be discussing about Synopsys Simpleware's application for 3D medical image processing and 3D printing application. The software finds its application in the core 3D medical image processing. So should I start now, ma'am?
Yes, sir. Yes, sir. Sure, sir.
Okay, thank you.
Okay.
So first, before understanding what our software does, we need to understand what is medical image processing. So right now I don't know what information our participants have here. So I will start with very basic. So medical image processing encompasses the use and exploration of 3D image data sets of human body, obtained mostly from a computed tomography or MRI scanner to diagnose pathologies or guide medical interventions such as surgical planning or for research purposes. Medical image processing is carried out by radiologists, engineers, clinicians to better understand the anatomy of either individual patients or population groups. So there is a lot of benefit of this medical image processing. So the main benefit of medical image processing is that it allows for in-depth but non-invasive exploration of internal anatomy. 3D models of the anatomies of interest can be created and studied to improve treatment outcomes for the patient, develop improved medical devices and drug delivery systems, or achieve more informed diagnosis. It has become one of the key tools leveraged for medical advancement in recent years. The ever-improving quality of imaging coupled with Advanced software tools facilitates accurate digital reproduction of anatomical structures at various scales, as well as with largely varying properties, including bone and soft tissues. Measurement, statistical analysis, and creation of simulation models which incorporate real anatomical geometries provide the opportunity for more complete understanding, for example, of interactions between patient anatomy and medical devices. So here is the basic image processing system flowchart, you can say. So first part is our acquisition. First part is acquisition, acquiring the 3D image dataset. So as I told earlier, it usually acquired by computer tomography or magnetic resonance imaging scanners. Then there is processing. This is the part where SimpleWare comes into play, or for doing your pre-processing of the data set, segmentation of the region of interest, detection of the anomaly, or detection of the anomaly in the human anatomy, and then analyzing the results that we get to complete our diagnosis. So today, this complete meeting, our session contains two parts. First is the presentation, which I'm giving now, and the second part will be the live demonstration of the software, in which I will show you how this image processing workflow is completed using our software. So before moving ahead, I would also like to discuss how medical image processing works. So the process of medical image processing begins by acquiring raw data from CT or MRI images and reconstructing them into a format suitable for use in a relevant software. A 3D bitmap of grayscale intensities containing voxel, the grid, creates the typical input for image processing. CT scan grayscale intensity depends on the X-ray absorption, while in MRI it is determined by the strength of signals from proton particles during relaxation and after application of very strong magnetic fields. For medical users, the reconstructed image volume is typically processed to segment out and edit different regions of anatomical interest, such as tissue and bone. In Synopsys SimpleWare software, for example, users can carry out different image processing operations at 2D and 3D level, including reducing and removing unwanted noise or artifacts with image filters, cropping and resampling input data to make it easier and faster to process images, use segmentation tools to identify different anatomical regions, including automated techniques with using AI-based machine learning algorithms, applying measurement and statistics tools, applying measurement and statistics tools to identify different parts of the image data, for example, center lines. Then we can import CAD models such as implants or medical devices to study how they interact with the individual anatomies. And finally, exporting processed models for physics-based simulations for the design work or for 3D printing physical replicas of anatomy in question. Now let's come to SimpleWare software. What is SimpleWare software? So SimpleWare software offers complete 3D image segmentation and model generation solutions for going from scans to 3D models. These scans can be of various formats, starting from DICOM, which are most used medical image formats, and then going ahead to JPEG, bitmap, and all other kind of images that we can find to convert them to 3D models. accurately process images, obtain measurements and statistics, and export high-quality models to design, simulation, and 3D printing applications. In the images here, we can see that here is a guide that has been 3D printed after the image was segmented and after the human anatomy was segmented and 3D printed or CAD model was generated. This is a flow. This is showing a simulation of the flow analysis. And then we have this very commonly used medical application where we are introducing a medical device into the anatomy to see its position and fitness. Simpleware can, if you broadly classify the application areas, Simpleware can find its application in these two areas that are Simpleware for life sciences and clinical applications, and materials and manufacturing. In life sciences applications, we have orthopedics application area. So in orthopedics, we can create very accurate anatomical models, and we can utilize the automated and semi-automated tools to segment our region of interest. We can combine CAD implants and anatomical data with our, we can combine CAD implant and anatomical data to find out the best fit of that implant with the anatomy. We can very accurate quantify bone geometries and export the multi-part finite element and computational fluid dynamic meshes to various specific solvers. Next application in life sciences can be product design and analysis. So using Simpleware, we can design, we can customize product designs to to the individual's anatomy, and we can virtually check fit of designs on the human body externally. We can export these models to simulate real-world performances in finite element solvers. So I think we will discuss about this in the live demonstration as well. Then for physiological flows, we can use it for cardiovascular and respiratory systems. Reslice the images along vessels and airways, quantify vessels with centerline network tools, and export this for computational fluid dynamic simulation to some specific solvers after generating the volume mesh. Simpleware also provides services for providing full human body or region of interest, whatever human body models for simulation. So we can integrate CAD designs like MRI coils or electrodes with the image data, and we can generate and export simulation ready meshes from the software. So Simpleware also provide a service where they can provide you with human body models for doing simulations. Medical device research and development is another application area where it finds its application, Simpleware. You can rapidly integrate CAD devices into CT or MRI scans. You can research human device interactions, which is very important when you are working with medical devices. You can automate repeatable operations with scripting. So we will discuss about these in further steps. For 3D printing application, Simpleware software can create very high quality watertight STL files, which are ready for 3D printing with all the internal lattices that reduce the weights, and use those printing. We can use those printed models as teaching aid in current to complete to incorporate into courses. So now we can discuss about some case studies, Simpleware case studies. So understanding where this software is finding its application in real world is very important to understand the capability of a tool. So we will discuss 3 or 4 case studies today. So first case study is patient-specific hemodynamic simulations of complex aortic dissections. Okay, so the workflow in Simpleware was developed to implement personalized CFD model of aortic dissection informed by non-invasive clinical data. So in this image on the left side, we can see this is the volume rendering of the data set that was imported into the software. This is the segmented data set, the red mask that you see here, which on which smoothing is performed, and here is the aortic dissection that you can see very clearly. And this was the model that was used for doing the simulation, the CFD model for doing the simulation. So Simpleware Scan-IP was used to extract the patient-specific geometry. Over here you can see from CT images. CFD simulations were done with ANSYS, and which provided hemodynamic insights that enhanced clinical understanding and supported the decision-making process. So these were some of the steps that were carried out in this case study. So we'll briefly discuss about this. So CT scans are obtained from patient-specific cases of aortic dissections. Data is imported to Simpleware Scan-IP to reconstruct patient geometry, including the processing of noise and segmentation of regions of interest, such as the dissected aorta and branches. Scripting is used to automatically carry out smoothing algorithms to remove pixelation artifacts. Surface models are generated from the dissected aorta and imported to ANSYS software to set up CFD simulations, including intraluminal pressure and wall shear stress-based indices. Simulation results create hemodynamic insights that can be used to help future clinical understanding. So what was the conclusion for this in this study? So this study presented a new approach for implementation of personalized CFD models using non-invasive and oftentimes minimal data sets commonly collected for aortic dissections monitoring, and demonstrated how combining commonly available clinical data and computational modeling can be a powerful tool to enhance clinical understanding of aortic dissections. So now the second case study that I will discuss today is torso model generation for simulating pacemaker performance. So this is a point where this is a case study where human device interaction is simulated using the model generated from Simpleware software. So this includes this case study was done by Simpleware, and this case was of Microport. So Microport developed life-saving medical products for patients around the world. And this cardiac rhythm management devices for treating cardiac rhythm disorders and heart failures are one of their specialties. So they use Simpleware software to model complex pacemaker geometries to better understand patient therapies for conditions such as bradycardia and tachycardia. Finite element simulation offers an alternate testing method that reduces reliance on animal testing, cuts the risk of device failure, and provides insights without the same ethical hazards as animal testing. So in the first step, the torso model which this company was using earlier was available via its its foundation and the US FDA. So Simpleware was used to remesh this model, and the original STLs were remeshed for processing. So over here we can see Simpleware software enabled fixes to be able to be to be made to individual part triangulation errors such as holes, vertex connections, and non-manifold edges. So here you can find these uh, errors you can see in this mesh, that we have holes, we have vertex to vertex connections, we have non-manifold edges, and this was the data set that this company had earlier from USFDA and ITAS Foundation. And these original geometries were processed in Simpleware, and a very accurate geometry in which there were no holes and no non-manifold edges and no vertex to vertex connections present. So here you can see, once the image data was segmented, Simpleware software was used to export simulation-ready models, volume meshes for COMSOL software, and NURBS IGES files for geometry editing and remeshing. The Simpleware meshes are guaranteed watertight with smooth, accurate geometries and correct topology without gaps. This level of quality makes meshes ready for electromagnetic simulations in COMSOL multiphysics. So on the right side in these images, you can see the smooth filtering in which there are no gaps between the two masks. So that is how a finite element mesh should be, so that the simulations can be performed with very high efficient results. Next, the human heart model was generated. To improve the detail of simulation, Simpleware software was used to process a heart model created from a separate dataset. The main task was to add chambers to the original heart model with image processing tools employed to remove unnecessary details from the image data, segmentation of chambers, and the closing of the outer surface of the model to a solid allowed individual NURBS files to be exported from Simpleware software into COMSOL. So on the right side, we can see the heart model, and the individual chambers were created, and the outer surface was converted into the NURBS model for each part, and then import was done into COMSOL for the simulation purpose. This is the simulation, you can say, outcome. So the meshes generated in the Simpleware were used in COMSOL software to test the placement of electrodes within the body and tissue conductivity when applying voltage. The output was the current pathway and the electric field inside the heart. In conclusion, the FE models were suitable for comparing different device in anatomic configurations to determine which configuration is better. The model can determine the optimal position of the electrodes and optimal pathway to maintain defibrilation at acceptable level to both simplify the implant procedure and deliver patient comfort. Using these techniques allow MicroPort to reduce their reliance on costly animal tests and improve efficiency and accuracy for their workflows. So the next case study we will discuss is the variability and accuracy of the spine segmentation. So this can be considered as a benchmarking for the Simpleware software. So patient-specific computational models of bone anatomy taken from medical CT imaging offer significant advances for biomechanics research. These include the ability to perform non-invasive investigations of joint mechanics and interactions between medical devices and the human body using finite element models. This study involved testing the effectiveness of manual segmentation of lumbar vertebrae, taking into account the proximity of articulating surfaces and degenerative joint changes. Simple with ScanIP was used to generate models suitable for measurement and analysis in MATLAB. 8 cadaveric lumbar spine segments were cleaned of muscle, loose connective tissue before being CT scanned with a slice thickness of 0.6 mm. The 3D image stacks were then imported into ScanIP, where a custom window width and level, as well as a curvature anisotropic diffusion noise filter were applied. Interactive thresholding and flood field tools generated a mask of the bone anatomy, which was then segmented into individual vertebrae and manually edited to deal with connectivity losses and across the facet joint. Morphological closing filters were applied before smoothing was carried out, and a model generated in STL format for export to MATLAB. Once exported to MATLAB, the quality of the segmentation was tested based on 2 observers performing the procedure twice on each specimen. Intra and inter-observer differences were calculated by registering the surface model with an iterative closest point of algorithm. A map of the nearest neighbor distances between each model was created for each vertebrae, and the distribution of the distances analyzed. 5 vertebrae were then disarticulated from the other neighbors, cleaned of all soft tissues, rescanned and segmented without adjacent vertebrae and soft tissue to evaluate the original segmentation routine. As a result, finally, the analysis of the segmentation indicated RMS errors, or the distance between neighboring points registered surfaces below 0.39 mm for accuracy based comparison between models before and after disarticulation. The test therefore demonstrated the accuracy of models generated from CT images of the lumbar spine in simple software, indicating the potential of future studies involving patient-specific modeling of the lumbar spine. So this would be the last case study that we'll discuss today. So that's modeling alternating electric fields for brain tumor treatment. So in all these 4 case studies, I tried to variate the application areas in medical image processing so that most of the participants can get to know about the capability of the software on their respective fields. Alternating electric fields. And one more thing, if anyone has any questions, please feel free to ask any questions at any point. I'd be happy to answer them. And yeah, and you can also put your messages, put your questions in the chat box if you are unable to unmute yourself. Okay, so alternating electrical fields or TT fields, tumor treating fields therapy, is a type of electromagnetic field therapy to treat cancer, particularly recurrent glioblastoma. This fields therapy TT field therapy delivers low intensity electric currents through array on the scalp and has demonstrated good results compared to traditional methods. However, the precise distribution of TT fields within the brain and the extent to which they cover the recurrent glioblastoma remains poorly understood. Computer simulation from the medical image data offers a solution for analyzing the effects of TT fields therapy for the treatment of glioblastoma. Simpler software was used to generate models for this purpose. So MRI image acquisition and tumor treatment. So in this step, the researchers aim to determine the frequency-dependent electric field distribution within a patient's brain. So in short, they acquired different kinds of images, different modality of images for this 67-year-old female patient with recurrent glioblastoma in the posterior right frontal brain for 6 months. 6 months after the initial treatment with neurosurgical resection, cranial irradiation with concomitant daily these drugs. Finally, TT fields therapy were recommended, with which she applied onto her shaved head continuously when possible. The placement of the transducer arrays was based on a personalized computer-generated layout, which is derived from MRI-based morphometric measurements for her head, tumor size, and tumor location. She continued both treatments for 24 months until another site of the disease was detected in the lateral border site. So the MRI image was acquired for this patient. Image processing was done using SimpleWare software. Over here on the right side, you can see that the segmentation of the complete region of interest was done very accurately using the ScanIP software. And using SimpleWare FE, the finite element mesh was generated for each of the segmented structures, including scalp, skull, dura, cerebrospinal fluid, grain, white matter, ventricles, brainstem, cerebellum, and the recurrent glioblastoma, as well as the transducer arrays that you see here. The composite finite element model was then exported as a mesh in COMSOL multiphysics. This is the simulation result. The result from COMSOL software, the FE solver, which is a FE solver tool. High field strength is seen at the ventricular horns, and there is inhomogeneous electric field distribution of the tumor. The new enhancing tumor is situated at the lateral border of the right lateral ventricle in an area with relatively low electric field. As a conclusion, analysis revealed valuable information on the procedure, including the location of the highest electric field strength around the ceramic discs for each array, and the potential to reduce scalp irritation. Inhomogeneous electric fields distribution was also observed on the tumor, while the MRI revealed a new enhancing tumor subsequent to treatment in a location with relatively low electric field intensity. Being able to understand the distribution of electric currents using models generated from imaging data offers an important method for analyzing the efficacy of TT fields therapies compared to conventional chemotherapies. Just give me a minute here. So now, as we discuss the case studies, so many of you have got a better idea about the capabilities of the software in real world scenarios. So now there are various modules available in SimpleWare software. So first is ScanIP. ScanIP is the base module, which provides the environment for all other add-in modules, and it has the tools for doing the segmentation. Most of the basic image processing can be done using ScanIP. FE is the finite element module. It is used for generating your finite element meshes, as you can see on the left side. It creates a very robust volume mesh for finite element and CFD analysis. Then there is this NURBS module. So this NURBS module allows you to export non-uniform rational B splines to a CAD-friendly export to CAD packages, CAD softwares. Then we have this CAD module that allows to integrate your CAD implants in the implants design in CAD packages to Simpleware software. So in the left image, you can see that this red implant has been imported and positioned into the anatomy. So this was done using the CAD module. Then there are some physics simulation modules, solid, flow, and Laplace for simulation of various properties. We also have one design link module, which allows you to integrate the ScanIP software with SolidWorks CAD package to seamlessly integrate the implant that is being designed in SolidWorks with ScanIP. So all the changes made in SolidWorks software based on the inputs from the ScanIP, the model, the anatomy can be reflected simultaneously into the software so that the best fit implant is designed. Our software also has some automated solution modules that are machine learning based, machine learning algorithm based modules. So these modules allow you to automatically segment your region of interest. So right now we have two modules in this, AS Ortho and AS Cardio. So AS Ortho allows for automated segmentation of the knee region from a PD-weighted MRI scans and the hip region from the CT scans. AS Cardio allows for automated segmentation of the cardiovascular system. It is cardiovascular system because it is considered a very complex segmentation. It usually takes around hours, like 3-4 hours to do the segmentation of the cardiovascular system. But if you see the difference, the automated module does this under 3-4 minutes. That amount of time that is saved in doing the segmentation and the accuracy that is obtained is very valuable in any workflow. These are the recommended system requirements to use our software. So the software is very efficient when we are using it in this environment. So now I would like to take any questions if there are related to the topics that I discussed right now. Can participants unmute themselves, Dr. Suta? Okay, so now I will move ahead to the next part of this meeting, my session. So next is our demonstration of Synopsys Simpleware software. Let me just start sharing another screen. Okay. So I hope you can see the software screen now. Let me just pause the screen share for a second. Okay. So I hope now my screen is visible properly. All the tools and texts are visible now.
Yes.
Okay, so this is the interface for the Simpleware software, and you can see that we have a ribbon style layout for all the tools that are available. On the left hand side, we have this project information, which displays the information about the imported data set. So right now, I think I have imported something. Let me just close it. Okay, so now you can see it's empty. And this is the application memory that it is utilizing right now. On the bottom, we have dataset browser. It will also be populated once I have imported something. These are the starting points where we can start by importing DICOM, DICO-ND images, various image formats, STL or CAD files, or volume mesh file for remeshing. Our history is present here. And this is the help and support section. It can be very useful when you are starting to use this software. So in the help section, you can see we have this reference, very detailed reference guide, which has information about most of the tools, I mean, all of the tools that are available in the software and the capabilities as well. Tutorial guide has tutorials starting from very basic to some complex image segmentation present over here in materials and manufacturing as well as medical application area. So these can be a very good starting point for anyone who starts to use our software. Then there are some options to get online support. On the top, we have this ribbon style layout for all the tools that are present. So I'll discuss one by one, or first let me start by importing some DICOM images. So I can click here, click on scan folder, and here I have stored the data. So I'll click select. So over here we can see a small preview of a thumbnail preview of our data set that we have imported and various other information that came along with the data set, like number of images, number of time frames, modality, study date, and etc. On the bottom, we have this preview tab, preview section, in which we can move with the slider to see through all the slices that are present, all the scanned slices, to see if we have imported the correct data set. On the right side, we have this DICOM tags. So these DICOM tags come along with the DICOM dataset. It contains information about the scanner, about the patient extents, as well as information on the, you can say, scanning technique or the technical details behind the scan. Those all can be found in this DICOM tag section. And files, you can see how many files were imported and etc. So by default, we have set to anonymize all DICOM tags. So I will keep it as it is and click on finish. And this is the data that has been imported. We can see all the three slices that, axes that are coronal, sagittal, and axial planes. Now you can see in the left side, this project information tab has been populated with details of the image that we have imported. It is showing the extents in various axes and the complete memory that this application is utilizing. On the top, we can see these tools are activated now. So I'll discuss about them. What are they? So in the Home tab, we have options for generating new models. Just a second. Okay. We have options for generating new models, like new surface model, new FE model, CFD model, or NURBS model, and the option for starting any new analysis. We have options for showing, hiding, or unhiding our information that we are seeing here. So if I click on project information, my project information is visible. In the image processing tab, we have options for doing your complete image processing. So all the tools for image processing can be found here, starting from some pre-processing tools like resampling, cropping, rescaling, shrink, aligning, etc. And then some segmentation tools, which is the most important tool. So we have a host of tools available for doing the segmentation, starting from complete manual to some semi-automated and some automated tools as well for material and manufacturing application area. Then we have some post-processing tools for like morphological tools present over here, like erode, dilate, open, close, and some additional filter tools present over here, like smoothing filters and some advanced filters that are present. As discussed earlier in the presentation, we have some AS tools, the automated segmentation tools that are used for completely automatic segmentation of the region of interest. So here I can segment the knee region from MRI scan, hip region from CT scan, and the cardiovascular system from angio-CT scans. Then we have surface tools. So in surface tools, we have options for working with our surface files, starting from importing our surfaces, creating a new surface, and transforming them like position and orientation, and doing some checks and making some fixes, and doing some editing over here. And we have some tools for conversion and generating some internal structure lattices. So I think I will show this to you as well today. We have some volume mesh option for importing volume mesh files. In measurements, this is a very useful tool when we are working with any kind of data set. We want to do some measurements like volumetric measurement or length and any kind of 3D metrological service that we want to take. See a few questions. Okay, I think Pradeep is answering this. Okay, and another question is it only for the CT scan analysis or other scan images can be given as an input to the software? So, Dr. John, as I showed earlier, here we can see we can import DICOM images. So DICOM images can be from CT or MRI images. Then we have input in the form of, okay, so you're asking about X-ray images. Yeah, so importing of X-ray images, yes, that is also possible. But as you can see, this is the academic version that I'm showing today. We have a medical version of the software that has some extra capabilities. It is CE certified, FDA approved, and it can be incorporated with the existing PACS system of the hospital administration. And yes, the digitized X-ray images can be imported for registering and pre or post operative planning, you can say, or comparison purposes. So yes, digitized X-ray images are supported in the medical version. I hope that answers your query. And regarding any other kind of scans, yes, micro CT, nano CT, any kind of CT scans can be, data can be imported using DICOM or direct images. So this images supports inputs from various micro CT scanners as well, like in TIFF format, in JPEG format. So those formats which some micro CT exports. DICO-ND is a relatively new kind of data file, which many micro CT scanners are also using now for exporting non-destructive evaluation application data images. Okay. So I was at measurement. So measurement can be very useful to have. We have some very useful tools present over here. So I think I will also discuss about some of them today. 3D preview is for editing your preview that you are going to see in 3D. View tab similarly edits all the slice views or any other views, what kind of 3D representation that you want to see. Okay. And my tools is a very useful tab where I keep my frequently using tools that I use very frequently over here, so that I don't have to go through each of the tabs and search through them to find the tool that I want to use. So I use these tools very frequently, so I have kept them over here. In the help section, it is the same as I showed you on the welcome screen on the right side. Let me see one more query that was here. So, Dr. John, it really depends on the physician that what kind of work they are doing. If it is completely clinical application, then they should use the medical version. If their application is more into research as well, I mean, many physicians also do their research work also. So then they can use the academic version, and it also depends on their requirement as well. So if they want to link our software with their PACS server, so that capability is only available in the medical version, and the X-ray incorporation as well as generation of digital X-ray from our software. I mean, from the CT scan that you are seeing over here, you can generate a digital X-ray as well. So those capabilities are available in the medical version only. And also it is C certified and US FDA 510K approved. So in Balatha, okay, I see. I don't know if that's a question or you are informing it, but yes, all kinds of images can be imported like X-ray, CT, as I informed just now. But for X-ray is supported only in the medical version, because it is only used when you are working in a completely clinical environment. So yes, so CT scan, MRI scans, those kind of images can be imported and converted into 3D models. So let's proceed with our data set that we have imported just now. So I can move with the slider to see different slices of the scan like this in all the 3 axes. I can move like this, and to see, to visualize the data set in 2D. Similar thing can be done in 3D. So here is the data set that I've imported, which is this is just the volume rendering that we are seeing. So I can change some options over here. We have some presets to change the visualization of this background volume rendering. Let me select bone, close it. So as I'm interested in the bone anatomy right now, so I have selected the bones preset. So over here you can see the data set that we have imported. We can verify that this is the correct data set that I have imported, and we can also identify our region of interest from here. So as I told, this is just a volume rendering, and we have not done any kind of processing to this yet. So our next step can be starting by doing some segmentation. So today we are going to be using this data set from CT DICOM data set from CT scan, and we will show you how to segment, how to separate hard tissue and anatomy. Also create a surface model for 3D printing and export for simulation as well. So let's start by doing the segmentation, or we can start by doing some pre-processing. So as you can see, this whole data set is not our region of interest. I'm only interested in the pelvic region in today's demonstration. So I will crop it down to that place. So we can use this crop tool. I can move these sliders from on each direction, whether it can be right, left, anterior, posterior, inferior, and superior. I can use these sliders in 2D as well as in 3D. So let's go with the 3D view because it's better interactive. I can press X, Y, and Z to orient my image in any direction. Change the view to parallel projection. This is better. So why I'm cropping it down? Because when I crop it down, you will see that the dataset memory requirement decreases. So that gives me enough room in my hardware, whatever hardware that I have, to do some processing very fastly. So I'll just click on apply. And now I have cropped down to the region of interest. So similarly in the 2D view, you can see the same. Next step would be doing the segmentation. So let's move to threshold. Over here, you can see a histogram of grayscale values. So I'll click on enable, yeah. And when I move this lower value of the slider, you can see a specific region is being selected or deselected as I'm moving my slider. So what it is doing is that it is selecting the selecting the range of grayscales in this lower and upper value. By doing that, I am selecting a region of interest and identifying it as a mask or generating the model of it. So let's do the segmentation by threshold. There are various methods of doing this segmentation also. So first is the histogram. I can use the slider in the histogram. Second method could be using this profile line. So I can draw a profile line and I can select the region of interest by moving this lower value from here. So it is also doing the same thing, but by a different method. And again, third method could be using the CT presets. There are some presets which can be used for calibrated scanned images. So if this was if this anatomy was scanned from a calibrated scanner, I could have used this value. But let's use the histogram, a manual approach. I can expand this. So let me just do one more thing. I have created the copy of this background image, and I want to show you another filter, that is a smoothing filter. So you can see there is a lot of pixelated noise over here. So let me apply a median filter on it, and it will just create a blur of all the images. So now you can see it is much clearer. So for difference, you can see here, this was the actual scan data, and this is the filtered scan data. This is the slightly processed scan data, you can see. Okay, so this looks fine. Let me just go back to threshold. Yeah. So here I am selecting my region of interest. Or I can work with the older scan as well. It doesn't make much of a difference, but let's just do it. Here are some options that you see. Fill cavities in the resulting mask, only keep the largest resulting island. So I will keep it unchecked so that I can show you a few tools that are available to do that at a later stage. So let's click apply. And now that you see that in every slice, a region has been marked as in this mask. So we are calling it a mask. And the same thing should be represented in the 3D view. So this is the volume rendering. And now I'm fast previewing my 3D view. So this is the 3D view of the model that I have just selected. So you can see that all these parts are in one color. So that means this is all a single region. And there are lots of unwanted selected artifacts, you can say in this case, or noise in this case, that I don't wanted to be selected. So let's just remove that. So we have a tool for that, that is mask flood fill. I will select this and select my source, that is mask 1, as you can see here in the dataset browser. And I want the output to be applied on all the slices and replaced with the current mask. So let us just see. Okay. So what I have to do, I have to select, I have to just click on the region that I want to keep, and every region that is not connected to that, it will be removed. So here you can see that everything has been removed that was not connected. So this looks fine. So I see this region is also here, which was not required. So another thing is here, which I can show you, is the 3D editing tool. So I can use a quick 3D editing, simple 3D editing to remove this region that I did not want. So I just have to align my view into a proper orientation to use these tools. Okay, and similarly, we have something over here. Let me just do that very quickly. So this is the kind of processing that we usually do when we are working with some data sets. We need to find out what is the data that we want to get out from this image. So let's leave it at that point and move ahead to the next step. So now our next step should be splitting the regions into the region of interest. I mean, the various anatomies. So let's move to this 2D slice. And here we can see that the femur as well as this hip bone is both in the same color. So we can change that. So changing the colors, it means I'm splitting these regions from this mask. So let's use the split region tool. I will create a new marker. And I'm drawing the marker on 3 regions. First will be the pelvic region, the hip region. I just have to mark what is which region is what. So one mark will be on the femurs, and another marks will be there. And this is the splitting method that I'm using. And I'm creating a new mask label for each object. Generate a fast preview to see that these 3 regions are separated now. So let me just quickly delete these markers and the old mask. And now let me show you on the 3D how we use the split regions too. So in the 3D, I just activated this live 3D and I'm creating a new marker now. And again, I have to utilize the same process. I will paint on my different regions here. So one region is that hip bone, another is this, and one is our sacrum. Like this, click on apply. Okay, this looks fine, and there is some post-processing required at this point. And something is required here. So yeah, so post-processing is always required in these cases because of the complexity of the anatomy, these post-processings can be required. So now let me just delete the old mask and old. Now let us just concentrate on one of the part that I will concentrate on this right femur. Let me just rename it. So renaming allows you to quickly identify what part is what. This is the left hip. Okay. So now let me just isolate right femur. So this is our right femur. Here you can see there are various holes or cavities present. So let's just start by filling those. So I'm zooming into my region of interest. And this process we have to do on each part, one by one. So what I will do is I will manually paint the regions that are open to the boundaries one by one. So I will do this on every 3rd or 4th slice. And then I will apply a morphological close tool to close the regions that are open. So let's find the first point where the region is open to the boundary. Over here I can see. I will go to paint and select the correct correct target over here. My paint tool is ready and I will apply on current slice, the active slice. So I will paint over here. Then I will move on to, yeah, this looks fine. Move on to the next third slice. So it looks fine. This slice also looks fine. And similarly, I will move on to other slices. So if I wanted a very accurate anatomy, I could do this on every slice. So just because that it would be a time consuming process, I'm doing this on every third slice and applying a very handy tool, that is the close filter. So please post your queries if you have something in the chat box. Myself or my colleague Pradeep will be able to get back to you. Okay, so now I have covered all the regions that are open to the boundaries. Next step, I will use this morphological close tool. Keep my strength as 3 because I was working on every third slice. Or let me just show you what I have done now. So here you can see that I have manually painted these regions to select them. So now I will click on apply and generate a fast preview again. And my mask, you can see it is a solid mask now. Next step would be applying a cavity fill filter so that I can fill up these cavities because I am moving it for a 3D printing file. So I will close the cavities. I will go to fill gap of any size, include gaps touching the boundaries because this is touching. Click on apply. And my whole model is converted into a solid. So this could be helpful in 3D printing purposes if I want to see the external structure of the model. Next step, I will use a recursive Gaussian smoothing filter. Over here, strength can be 1.5, I think it's fine, or I can keep it at 1.6 and apply. So this filter applies the smoothing operation and doesn't alter the actual geometry very much. So here you can see the output, the final output that we got. It is a smooth anatomy, and the more accuracy can be obtained by providing more time on the segmentation. Now, my next step for exporting it as a 3D printing file can be converting it to a surface. So for that, I will go to the surface tools. In dataset conversion, I will click on mask to surface. And first, before that, let us just generate a model preview of this for a better quality image. And then again, go back to mask to surface and generate surface. So now my surface has been generated. So why I generated a surface? Because we want to export it as a STL file. So it looks fine. Next, I want to generate internal structures because for 3D printing, you need to have some support and also at the same time reduce the raw material required for 3D printing. So let's just start this internal structure wizard. Next, shell. So I want a shell thickness of, let's say, 2.5 mm. And inner shell triangulation could be coarse or fine. So let's keep it at a default value. Next. There are various unit cell types that are available. So we will be using the default one, and this is the model that lattice is. So let's go next, and now it is generating the internal structure for my model with a cell thickness of 2.5 mm. Let me just hide my old mask here. So to verify it, I can clip it to see. This, let me just clip it down like this. And here you can see the internal lattice that has been generated just now. So here you have this cell thickness of 2.5 mm, which will be the actual 3D printed surface. And then we have these internal lattices for the support purpose, as well as reducing the raw material required. So now my next step can be, let me just generate a model preview again for this surface file. And I can click here to export it for 3D printing, the STL file for 3D printing. Our file type can be ASCII or binary. And I can click on export, and then it will be exported here. So STL file is exported now. So let me just quickly switch to my another screen in which I will show you some different data sets. So I hope my screen is now changed. And here we have, I have already worked on this same data set earlier. And this is the geometry that I obtained from it. This is the same data set that I showed you just now. Similarly, I created a 3D printing surface for it. So let me just generate a surface model for this. So here you can see it is a very fine mesh, which will provide a very accurate output. I don't think you can see the mesh very clearly. So yeah, like this. So here, I can change the view to see the wireframe only or solid only, like this. So here you can see the quality of surface meshing that is very vital in 3D printing, accurate 3D printing process. Next, I did this for all the parts. So next, I want to show you the volume meshing that I did. So let me just generate a full model. Yeah. So this is the volume mesh that I have done. So now what I can do is I can export it for 3D printing purposes. Simulation purposes. So I can show you like this. So this is the volume meshing that I have done earlier. So if someone is into simulation, as I showed in few of the case studies, so here you can see that we have lots of options for configuring my my finite element simulation. So on the top, we have model type and export type. So for exporting to various softwares like Abacus, Adina, ANSYS, COMSOL, Nastran Pattern, MATLAB. So we can select these export file, and the compatible tabs that are open here will be shown. So let's say I select MATLAB. So in MATLAB, I cannot define or work with the material boundary condition. So we don't see that option here. So let's go back to ANSYS. We have all the options present here. We can change the volume meshing coarseness. We can define material values based on grayscale variation. for each of the parts separately. So if someone in the participants is into simulation, they can understand how vital this part can be. Next is setting up contact points, node sets, shell sets, mesh refinement for a specific region of interest, which can be useful for people who want to concentrate their results on a very specific region of interest. And boundary layers, finally, which is mostly used in CFD analysis for setting up various boundary layers. I can click close and then full model generated and export it to ANSYS supported file. As I selected ANSYS over there, so I have this here. I will click on save. It is now exporting all the elements. And now I can see all the tetrahedral elements, how many tetrahedral elements were created, what was the mean in-out sphere ratio, what material it was created for all the parts over here. So someone has raised a hand. Yes, you can unmute yourself, please, or if you have any queries. Okay, so this was exported. So this was what I had prepared for the participants or my meeting today. So I hope this gives you a very good idea about what Simpleware software is and what are its capabilities. So for summing up all the capabilities, Simpleware finds its application in all those research and clinical application areas where people are using it for 3D printing applications, where 3D printing applications, clinical applications such as surgical planning, implants design, and many other applications. So to give you a very rough idea about the available research in orthopedic engineering using Simpleware software. So there can be various research areas in which our software can be utilized in orthopedic engineering research areas, like investigation of biomaterials and biomechanical properties, new material development for implants, artificial implant of human organs, higher accuracy of CT image-based 3D model for finite element analysis. So various research areas can find its application. I mean, Simpleware software can find its application in various research areas, like implants design can be a very big area. Then biomaterial and biomechanical properties investigation. Okay, so please let me know if someone has any questions. So I'll be present here, and please let me know if someone has any questions. So Dr. Sudha, that was all that I had prepared for today's session. So is there something you want to add now? Or?
No, sir. No, sir.
Okay, okay. So I see that there are no more questions. So I can end this session from my end. So that was all that I had prepared for today.
Thank you, sir.
Thank you very much, ma'am, for allowing us to present in this.
Thank you.
Sir, it is indeed a great pleasure for me to deliver the vote of thanks. On behalf of the Department of Biomedical Engineering, PSNE, College of Engineering and Technology, I would like to thank Mr. Yashu, Senior Application Engineer, Integrated Microsystem, and who gave a very nice talk on
Your voice is
3D
cracking.
medical imaging processing and
Priyanka ma'am, your voice is breaking actually.
ma'am is audible.
Now
Ma'am, okay.
audible only.
Okay, ma'am. Who gave a very nice talk on Synopsys Simpleware software for 3D medical image processing and 3D printing application. I'm sure the participants would be highly benefited from your presentation. Thank you, sir. Thank you, sir, for your informative section.
Thank you very much, ma'am.
Thank you, Jigasu and Pradeep sir. Thank you, sir.
Okay. Thank you.
Dear participants, the next section will start exactly at 2 p.m. Thank you.
Thank you so much, ma'am.
Thank you, sir. Thank you.
Thank you, sir.